But on behalf of Dr. Dean Ellison in the College of Medicine, we welcome you to this conference. And really, I was interested to see the title of the conference being Direct Observation in Medical Education, and really it looks like, based on the participants, it's in health professions education. And certainly those components, as we look at health professions or healthcare in general over the course of a great number of areas of expertise, the implication is that those things are translatable. But really what we're talking about here as sort of a core component that builds into the changes in healthcare or health professions education that reflects the changes in the healthcare environment itself. No matter where you are within the world, right, healthcare is changing as a continuous process, and therefore the educational paradigms that we use must change as well to ensure that we are creating the next generation of healthcare providers that have the competencies that enable them to be successful in that realm. And that goes to not only sort of developing wonderful curricula, and I think we sort of, if you look at the medical schools within the United States, we've really made some changes, sweeping changes across the country in changing curricula, maybe even changing teaching and learning methods, but maybe not so much in regards to assessment. And unfortunately, as hopefully you'll hear today, right, assessment is actually how you should think about it first as you create your curriculum and your teaching and learning methods. But you find many times in the process is assessment comes as an afterthought, and that's not necessarily sort of the best in practice. And so what we really want to do, though, really, is to create an environment of assessment that aligns with the competencies that we are trying to have our learners achieve so that they will be enabled to be successful as they directly enter into the healthcare workforce, right? So what ideally we have in competency-based assessment and education and assessment is that those graduates are reliably able to perform. Hopefully at an excellent level, but certainly at a competent level, right? So that your graduates are able to go out and consistently behave in a manner as expected. And so this is a lighthearted welcome. So, and many people here have seen this slide before. So this is, we have just a little farm that's outside Columbus. And so we have all these chickens, and sometimes we have goats, and we have all these different things because my children want them, right? Not because of me. So here's my story. So this is just before I went to work. So you could see there's a little path shoveled to the barn. I shoveled that before I went to work. And so my 11-year-old son was very happy because he didn't have school that day because of the snow. And I said, your one task today is to make sure there's a path to the barn so that when I get home I can feed those animals, right? Very simple thing. So I get home. It was after dark. It was like 9:30 or something. And I can't even, like the snow is like probably halfway up the barn doors. So I'm furious. I am so angry because now I'm going to have to trudge through that to go feed those animals. I get in the house right after I sort of get the clothes, and I don't normally yell, but sort of yelled for my son to get down to find out what he was doing all day instead of shoveling. And before I even say that, I hear him pound down the stairs, and he comes to the kitchen and he says, I knew it. I knew you were going to come in and you were going to say that I didn't shovel and I didn't do what you asked me to do. He said, because let me tell you, I had Arabelle, his sister, out there documenting because what I did was, I did shovel. He said, I went out and shoveled when it was ankle deep. He said, and I continued to shovel. And then I went back in and I came out and shoveled again. And then finally, it was too much. I'm 11 years old, Dad. It was up to my chest. I can't shovel no more. And he had this all prepared. He had the pictures and everything. So I was deflated, right? So the moral of the story is things are not always as they seem, right? This is what my 11-year-old son tells me. So you do learn from your children. But that's very pertinent to this conference, right? That's what direct observation of competence is about, right? We make assumptions about our learners' performance based on a lot of different clues that we get, based on our different assessments. But it's the direct observation Whether it's components of observation, so different pieces of an observation that you put together, or the entire observation that really tells the full picture. So if I was there watching my son all day, I would have never come in storming and yelling and sort of was screaming that he didn't do what he was supposed to do. And the same thing about our learners. You cannot necessarily tell how someone's going to perform in the clinical environment by doing a pen and paper test, right? It's through that direct observation, and as hopefully what you'll hear today is repeated observations. And this is one of my other favorite slides that I use a lot, right? There's an immense value in the right fit, right? So your assessment method needs to fit the competency domain you're assessing and the particular component of that competency domain. So for example, in patient care, a big component is likely to be direct observation. But there are also other components within that competency domain that ultimately build up to you making a determination of whether that learner is competent or not. And so hopefully what you'll hear today are not only tools you can use to facilitate your direct observation of competence, but also the ability of how you can put together all of your assessments to assure that you are assessing your competencies in the way that you can reliably say that your graduates that complete your program are able to competently perform in that environment. Because if that's true, if you are the place that people know your graduates are consistent performers, that's exactly what we want, right? We want our educational process to have a consistent, and I don't mean to use the term product in the form of students, but that's right, it is our educational process at the end of that is someone who can perform competently. So thank you for your time and welcome to the Ohio State University College of Medicine.